Hello. Oh, they're not admitted. Sorry. Hello and welcome, folks. Thanks for joining us.
But he's still really into it.
If we could just make sure we are all on mute, please.
But yeah. It just says thinking too.
Thank you. All right. Thanks for joining us today, folks. For those of you that don't know me, I am Vicky Casorena. My pronouns are she, they. I am a senior field rep with Apprenticeship Minnesota, and I do a lot of supportive services for registered apprenticeship programs and apprentices. So I have the pleasure of working with Cal over at Safe Project to work on some programming regarding mental health, substance abuse, and suicide prevention. You may remember last year we did a series with NAMI, and this year we're partnering with the SAFE Project. So without further ado, I'm going to go ahead and turn it over to Cal, who's joining us here today. Cal, I'll let you introduce yourself and take it from here.
Thank you so much, Vicky. I've really enjoyed getting to know you, and we have some mutual friends and common interests. And one of those is that I used to live in Minnesota. And before I lived in Minnesota, I was helping launch a national mental health and suicide prevention initiative in the U.S. construction industry. I officially did it when I moved to Washington State, and I began partnering with apprenticeship programs by 2015, thanks to some great partners I had there. But I think your state is very fortunate to have Vicky. She's been a driving force. The things that she's been offering, I think, have been really powerful. And Safe Project, the national nonprofit, is excited to have this opportunity. We started in 2017. We're based in Virginia. We have a virtual staff, and we work in 4 key areas. We work to reduce the effects of the addiction epidemic in the United States. And we work in 4 key areas: on college campuses, in communities, with veterans and caregivers, and I am the senior director for Safe Workplaces. What I'm really excited about is we have 2 other specialty directors. One is a full spectrum prevention. I'll talk more about her later, but the second is a director of recovery. So we have the opportunity to bring some pretty innovative programming to workplaces like your apprenticeship programs. And along the bottom, we operate in these 6 different lines of operation, is what we would call those, but they're focal areas. And what I love about apprenticeships, we're building futures for people, not just a job, but careers. And that's why I have loved being part of apprenticeship programs for as long as I can remember. I've been a construction risk management and safety professional focused around well-being. In 2010, I was appointed to the National Action Alliance. It's the nation's public-private partnership. And one of the visions I've had is to embed the intersection of substance use, mental health, suicide, and overdose prevention into workplace learning. And this quote was attributable to me. And what I love about Safe Project is we do focus in 3 key areas: prevention, harm reduction, and recovery strategies. So it's just a perfect opportunity to embed this in apprenticeship programs. And I'm going to be asking you some polling questions as we go along, so you have an opportunity to share where you're at in your apprenticeship's mental health journey. So I'm going to give a couple shout outs today. One of the apprenticeship programs I left behind when I moved from Washington State to South Carolina earlier this spring was called Anew, and they had various pre-apprenticeship programs. I had the privilege of being invited 4 to 5 times a year to come in and have the opportunity to partner with their classrooms. Sometimes they would combine 2 or 3 classes, and I would have 60 to 80 apprentices at one time. And usually they'd give me a 2-hour allotment, and we would just talk openly and honestly. You'll see that no shame pledge. Our next session is going to be led by our director of prevention and recovery, and they're going to talk about stigma and how to build a recovery supportive workplace. So I just wanted you to think about your apprenticeship program and to think how these techniques that we're going to talk about today could be applied by you. And secondly, I get the opportunity frequently in publications to amplify leaders and programs that give me hope. And one of those is based in Minnesota. Vicki and I both know John Burkaw. I hope all of you have the opportunity to get to know John. He's with the Finishing Trades Institute of the Upper Midwest in White Bear Lake, Minnesota. They're affiliated with UPAT, the International Union of Painters and Allied Trades. But you'll see this article I had the privilege of writing a year ago, Changing the Culture of Construction at the Apprenticeship Level. John has been doing physical health screenings and then mental health screenings. And the program that he has done is very innovative, but it's also been saving lives. And I just like to share those stories that give us hope when people take leadership responsibility to help other people. So a big part of what we'll talk about today will come in these polling questions I intend to ask you. This QR code is called Slido, and Slido is an anonymous interactive polling tool. It's going to allow you to respond to my prompts. You'll do answers and we can see collectively how the group is feeling on certain topics. So I found this to be a very good way to do these tough topics like mental health, substance use, and suicide, and even overdose prevention. Most of you should be able to get in using the QR code. Some of you may need to type a new browser into the window and type slido.com and enter that 7-digit code, 3545246. And the QR code will be on each of the polling questions. So I tried to do this as I would if this was a live session. The first one's going to be 2 pre-assessment questions. Before today's session, how comfortable do you feel talking to apprentices about these mental health topics? Mental health, substance use, suicide. 10 means you're very comfortable. A 1 means you're not comfortable at all. The most important lesson we'll have here is that we need to approach safe messaging when we talk about these topics, because not everyone will be comfortable. I expected with this audience and the fact that you've had prior programming that this would be a pretty high group, but you'll notice our average score is a 6.7. We range from a high of 9 to right now a low of 3. And that average score of 6.5 is a fairly typical construction audience. It took 5 years to move us from a 2.5 average when I started doing polling to a 4.8. But since the pandemic, we've seen this number increase by almost 50%. So this 6.5 shows me this is an audience that's accustomed to having these conversations, and yet we have people that are less comfortable. That's a really powerful statement. And then secondly, even if you feel comfortable, I want to understand, have you had access to resources? So before today's session, how well equipped with resources do you feel to have mental health topics in your classroom? 1 would be, I don't have many resources. A 10 would be, I have ample resources. And I typically do find this number will be lower than our willingness to have the conversations. And what I've done is built some resources into this program, and you'll have those as an appendix, and I've tried to tailor them to Minnesota specific resources. So here, this was a 5.9. Again, as instructors and as program coordinators, you're accustomed to having to build programs and be resourceful, go out and tap AI and other resources. So that 5.1, though, shows that I hope the resources I'm going to provide you through Vicki will be helpful for you. So here was the first real non-pre-assessment question. Where is your apprenticeship program on its journey with mental health and well-being for apprentices? I put 4 categories. Everything from we have not addressed mental health and we're feeling behind, to we've taken baby steps, but we're still wobbling. The third was we're doing more each year and we're seeing traction. And the fourth, we're in a groove. Instructors and apprentices have embraced our efforts. And I felt like this would be good for people to see where we're at. And when I see the responses, I'm happy to see that no one identified being behind. So you've started this journey, and then it was 50-50. You're more than the baby steps, and you're seeing traction. So I hope that some of the ideas that we talk about today will give you some ideas that you can apply in your classroom. So thank you for this participation. And then I thought it would be important, what barriers keep the apprenticeship program from incorporating mental health topics into your learning pathways? And this one, you should have the opportunity to list multiple choices. This will be useful for me and Vicki as we talk about additional programming and additional resources that we can share with you. So thank you for voting. This one will take a moment. You have multiple choices, but I just wanted to see what people were thinking. So this one will just take a moment, and then we'll jump in with additional programming ideas and conversation. I get that a lot too on the lacking subject matter expertise. So I wanted to show you a method that doesn't require a lot of expertise. It just requires a willingness to learn and apply. And some of the learning methods that I'm going to use, I hope will be helpful. So right here, we're seeing these responses start to cascade in. And what I like is it shows us what multiple obstacles or barriers we have to overcome. So we have about 50% of the participants already voted. 75%, number one, lacking subject matter expertise. 63%, too many competing priorities. The third one, and you see I put it in quotes, afraid to open Pandora's box. Sometimes it's people not knowing what will happen next and how do we keep this to a manageable level. A lot of times there's stigma associated with that, a fear of trying the unknown. So that's why we have second topic coming up on July 29th to talk about those things. I was really happy to see few of you identified, not sure if the instructors will be on board, and then don't have capacity to add more content to the curriculum. I think it's powerful. We did not see a lack of support from board and trustees. I think we've come to the point, mental health is a mainstream topic, and everyone has mental health. We need to be prepared to offer support. I mentioned in the beginning that I am a historic risk management and safety professional. I specialized in an area I called human capital risk management, teaching people how to take care of people. So I was responsible for building caring cultures in multiple industries. I worked in healthcare through high school and college. I started my career working with public entities. I moved to the construction and manufacturing industries, but I've worked in a number of industries. And this idea of workforce risk is real, and it's rising, and it continues to rise. We have elevated levels of stress and anxiety, more and more employees and professionals at different levels describing this idea of burnout. And some of the factors that have contributed would be relationship issues, financial pressures. Sometimes it's grief, caregiving responsibilities, among apprentices, families returning to the workforce. But I also wanted you to think about that intersection of substance use contributing to suicide and overdose if it's unresolved. In workplaces, we have a hard time for people feeling comfortable disclosing those challenges. And at Safe Project, that's what we're doing, is doing something about it, teaching you how to build a supportive environment and to offer people a gateway for help. So I wanted to share with you, I'll use one industry because it is an industry where we've had extreme challenges, the construction industry. And if you're looking for data for a different industry, feel free to reach out to me. My contact will be at the end, and Vicki will know how to get a hold of me. But a lot of times we can find similar data. So I'm going to click through these, but I wanted you to know, in case you're not aware, in our industries, our workforce has embedded risk. And these are some of those major risk factors that I just wanted to identify. For the construction and mining industry and industrial manufacturing, including trucking. Many of these overlap. They're still called male-dominated industries where the employment is heavily skewed toward men. I think it's important to recognize men don't always have primary care physicians and don't do as well with the preventive health care. Issues get unresolved, they get worse, and they turn to chronic health conditions. What you'll see in industries like construction will be higher than expected anxiety and depression issues. Self-medication, a coping strategy, can lead to heavy and binge drinking. We have high rates of substance use. In all industries, the National Safety Council and other groups have identified about 8.5% in all industries of workers would have a substance use disorder. In construction, it's almost twice that. And a big factor has been the number and the severity of musculoskeletal injuries. You're probably thinking sprains and strains, that heavy exertion and repetitive motion that contributed to more than our fair share of opioid prescriptions. And you'll see some data there. The more of those work-related musculoskeletal injuries we have, increases the likelihood of opioid use. And then two areas that don't often get talked about, but increasingly do in states like Minnesota, is suicide. In this construction industry, the mining industry, 72 per 100,000 workers. In construction, heavy male skew, 56 per 100,000, but the rate was still elevated for females at 10.4. So every life matters, and we want to illustrate how important this is. And the overdose rate has improved, but I want people to recognize it was almost 2.5 times higher in the construction industry compared to the suicide rate. That shows me how much stigma we have and how afraid companies have been to use things like naloxone on job sites. So bottom line, I call this the elephant in the room, and it's important that we acknowledge it, not only in the workplace, but at home. What I have seen for the 25 years that I've been addressing topics like this in workplaces, if we help someone at home, we're more likely to feel comfortable to do it in the workplace. So it's important that we acknowledge that there is exposure and that people need help. And if not us, then whom? So this is a call to action to be part of the army of helpers and to find ways and resources to offer people support. Now, one thing that's important to recognize when it comes to substance use, it is unlikely to get better by itself. However, between 40 and 50% of individuals will do self-recovery. They call it natural change or natural recovery, and it can get better, but it can also be worse if it's unresolved. So I wanted to just share with you a quote from a gentleman who's a friend of mine from Minnesota. His name is Ray Stenglein, and if you have an opportunity to hear him speak, I definitely recommend it. I've had that privilege multiple times. Ray is a volunteer for the American Foundation for Suicide Prevention, and he partners with Live Well in Minnesota as well. He talks about the essence of hope. He lost a daughter to suicide, and he wanted to help families reduce the pain they experienced. So in Ray telling his story, he shared that a person can live 4 weeks without food, 4 days without water, 4 minutes without air or oxygen, but only 4 seconds without hope. Those words riveted me when I heard him speak because I've known the pain of suicide and overdose and wanted people to know we can be hope providers. We can be a difference in our world, but only if we choose to become educated and to take that call to action seriously. So that's the essence of hope. I wanted you today, when I'm talking about these topics, I'm going to use safe messaging, but I have to go quickly. So I want you to think not about the embedded sadness, but about the hope that is possible When we shine light into someone else's darkness, they may seek help. And if people seek help, healing can begin, and that means recovery is possible. So I use three words: hope, help, recovery. But I wanted you to think about how important it is to not wait to have a conversation. If people are at a point of crisis, it may be too late to help them. But if we move upstream and offer them help when their behavior changes and we first become concerned, we can make an appreciable difference. We can have an impact. That's why this program is so important to me. I wanted you to know about a gentleman I hired in Minnesota. His name is Jeff. He was known as the big dog. And Jeff and I were teammates. I hired him in 2004, about a year after I moved to Minnesota, to work for an insurance company that specialized in construction. Jeff was an incredible teammate. He was a dear friend. My family knew that he was there if I was ever not available because I traveled too much. I helped Jeff as a manager with a bout of addiction, and Jeff got better. And then Jeff returned to active use. Jeff's depression and bipolar got worse. Jeff ultimately took his life and died by suicide. I never felt guilt. I felt sadness, and I still do, because I wish I had recognized that Jeff was wearing masks when he told me he was fine. It took me a while to peel back some of those masks, even after we lost Jeff. And I recognized as a leader, I could do more. Jeff always asked me about my work with suicide prevention nationally, and he always thanked me for helping people like us. Jeff understood me, and I understood him. At his memorial service, his family asked me to please make my voice a little bit louder so no other family had to experience the pain that we were feeling. They decided to be vulnerable and to talk openly and honestly, and they asked me to feel comfortable sharing Jeff's story. Initially, I did to honor a lost friend, but I also recognized how important lived experience is. Jeff isn't the only coworker I've previously lost. I lost a extended family member when I was 12, a neighbor at 13. I experienced this when I worked in an emergency room in an ICU when I was in high school and college. So I've been exposed to this over the years. But what happened when Jeff died is I declared war on suicide. And literally, I had a declaration. I'm like, you going to take one of the good guys? Now you got to come through me. And those of you that may know me from my previous work, I changed because I'm not waiting for people to be ready for me to talk about it. I was going to embed this in every conversation I had. And we broke down the stigma. And 12 years later, when we hosted a meeting, there were 10 national groups doing work on suicide prevention within 10 years. We've done a lot of good. And what is happened in our industry can be copied by other industries. So if you need guidance, I can point you to people in Minnesota that can offer you that support. I used a phrase called stigma schmigma. I was invited to the White House in 2016 after Jeff's death, and I was there to declare what we were going to do in the construction industry. So that phrase, stigma schmigma, has special meaning. And that's where I want you to know about my friends, Rana Yablonsky and Sydney Chaifetz. They are going to be the leaders of the July 29th session. And I please hope you'll come back, learn how to overcome stigma. So here's where I want to go. We'll have to move quickly, but I think I want you to see this has been one of the most powerful ways to get people to recognize I can help people. So here, I want you to be open and vulnerable. How do you feel when you're stressed out or hitting the wall? Type one or two, 3 to 5 words. Keep them short little phrases, but how do you feel when you're stressed out or hitting the wall? This is really powerful to do in a classroom because you get to show people how other people respond to stress. So thank you for that first person. I see more people typing. Please type as many as you'd want. If this was a larger room, we would start to see this word cloud fill. And this creates some empathy to put yourself in other people's shoes. We know how we respond, but now we're understanding how other people react. So overwhelmed is the number one answer. That's why it became larger and has some color. Then we had hair trigger, survival mode, unmotivated, detached, fried, closed off, exhausted, panicked, sick, and capable of violence. Each of us will react differently. And that violence could be self harm or it could be directed toward others. It could be punching a wall. That idea of hitting the wall is real. Exhausted. So, what I teach people when we do this is when you see someone reacting differently than you, stop, observe, take deep breaths, think about how and when you could approach them to let them know that you care. That can have an overwhelmingly positive impact. But the one on one is what makes that effective. And the non judgment will be powerful. So we're going to move on just because we don't have 2 hours. We have 1 hour today. Who do you talk to when you're stressed out or hitting the wall? You should be able to vote for multiple choices here. But who can you call? Who can you talk to? And so, again, I'll look forward to seeing your responses. What I know is when we wait for a crisis, at that point, people feel so isolated, so withdrawn, they feel alone. They often can't think of who they could call. But what's powerful is when we ask people, who do you call? It almost starts to build a safety plan. So whether you're concerned about someone's use of substances or mental health or behavioral, uh, you know, challenges, it's important to think about who might you refer them to. This answer is a pattern I've seen well over 250 times. This is spouse, partner, significant other, 90%. Friends or coworkers, 73%. And family members, 55%. Rarely are family members and friends flip flopped. This shows this is natural for us to have peer support in workplaces. We used to worry about how are other employees going to respond, but we're already having these conversations. And this is just a validation. I also wanted to highlight the 36% who identified therapist, counselor, a doctor, or a specialist. That's powerful. That's, again, vulnerability. And if you were to do that, if it was appropriate in one of your classrooms with students, it's powerful for people to know that that's modeling positive behavior. The hard part is EAPs or hotlines rarely get a response. Clergy rarely gets a response. So I just wanted you to think about this is why we can have these conversations in workplaces, including classrooms. So the third question I wanted you to think about, I want you to list as many of these good qualities that you can. What have been the best qualities of the people who helped you when you were stressed out or hitting the wall? What were their best qualities? And as instructors or program coordinators, thanks for that active participation. I always have that fear. What if no one participates? But I knew today was going to be safe. I knew you would. And I just going to let this populate. I want to give you time to actively think. And please, if you think of 4 or 5 or 7 or 8, just try to do them as separate entries. Still looking for a few words that hopefully are being typed. Thank you. That was one. That's the second one. There's the third one. So you're doing wonderful. Excellent. Wow. Okay. I knew they were coming. I could see it was log jammed. So let's talk a little bit about these. Compassion, active listening. Those were the top 2. Look at that non-judgmental, caring, supportive, patience, calm, giving feedback, people who were helpful. They weren't fixing it or solving the problem. They were present, listening, and offering a listening ear. They were able to process this. And I think that's powerful. So, what this shows me every time I do this, thank you for that give a perspective, is when I do supervisors in workplaces, they always have more empathy than they're even aware of. You're recognizing these qualities that other people have used to help you. So I get sad when people tell me, I don't know what to do. Well, look at the examples you've just provided. This worked for you. It's likely to work for someone else. To me, the most important is keeping it non judgmental, but the rest of those are the ingredients for a successful peer support. And I just want to thank you for building out that word cloud. I should have said this earlier, but I'm going to send Vicky a listing of all the word clouds, and she'll be able to send that and a PDF of the slide deck. And you'll start to see the power of doing something like this in a classroom. Anyone can teach this way, and it becomes a powerful interaction. After you use this model in a classroom, it opens the door for people who are seeking help or seeking support or want to learn more or willing to volunteer to come forward. It uncorks the pent up desire to offer help and support. So I just thought if I modeled this today, this would give you a good set of tools to use. So the next one I like to use is what are healthy ways you de stress or practice self care? Some people call this recharge. Some call it recentering. Some call it grounding. Whatever it is that we call it, I call it decompress. So please list as many of these things that you find helpful, useful. And you'll notice, again, I wanted to model good behavior. If I list healthy, I generally will get healthy responses. So I learned over time to be specific in my request of learners. So look at this powerful list here, and we're going to give this just a moment because we can. We have a little bit of time. What I love about this is many things. One, recognition that we need to help ourselves before we can help others. The airlines got it right. Put our mask on first before we help others. And that is so important, this idea of self care. Secondly, have variety of self care. If you have one go to and you get injured and you're a bicyclist, you might not have another hobby and you might then feel frustrated. And it allows you to connect with what your activity was. So try to get multiple opportunities. The third, most importantly, this is an opportunity for you to connect people to your activity by inviting them in. This is often one of the ways that people offer people support. So look at all these lists. I can't name every one, but this really is powerful. I wanted to share with you when I first moved to Washington State, we were launching that mental health and suicide initiative for a contractor, but I started getting invited by other companies to come out to help their employees or to different project sites. And one of the coolest projects was a large civil project that had a lot of workers. And the safety director said, I can't do what you do and talk about these things, but I'm pretty good at caring for people. And sure enough, he was. He started meeting with new workers who were going to come to his site. And then he started a fishing club and he packed lunches for everybody. And it started with 3 to 4 people, quickly went to 6 to 9. Before you knew it, there were almost 20 people going fishing. And then different people said, we don't have to all fish together. We can go off as separate groups. They ended up going 6 years before they had another attempted suicide on a very large evolving project. It wasn't an accident in my mind. It wasn't a coincidence. That was intentional connectivity that was built. So that idea of involving people is so key. Now, I also wanted you to know, just because you've seen this method, People sometimes are afraid to initiate a conversation. This was a public safety campaign and a public health campaign. It was called Seize the Awkward. It was acknowledging, yes, the first time you have this conversation, it might feel awkward. I'm not going to read the quotes that follow. I want you to hear your voice. I want that to be what you think of when you hear yourself read these prompts. And then we'll talk about these prompts. But these are ways to initiate a conversation with someone you're concerned about. You'll notice some commonalities here. These are direct, but not in your face. So these are opportunities to let someone know that you care and that you're concerned. You're also able to show support. What I have found about these is if you pick one or develop your own, it becomes a guide that you use to navigate that first conversation. Don't forget, most people won't take you up on that offer of help the first time you ask. They'll say, I'm fine. Hey, I'm really fine. And then you'll ask, are you really good? Because it doesn't seem like you're good. And that person ultimately will open up. So I wanted to give you a technique for having that conversation. If we were a live audience, I would ask someone to say, this is the one that I would use. And when I do that, again, it shows us the more vulnerable we are, the more responsive others will be. I use a tagline that I developed. I care too much to not say something. And that helps me open that pathway to a conversation. So I wanted you to see that 4-question model combined with an introduction, how to initiate a conversation, is often enough to have those first conversations. Your goal is to help connect people to resources. And if someone says, yes, I need help, one way of doing that is to recommend the hotlines that exist. So there's going to be 2 primary ones that I want to teach you a little bit about. 988, the nation's 3-digit hotline. Minnesota has been an advanced state. It's always fun to do this in Minnesota because so many people are aware of 988. In the old days, prior to 4 years ago, we had a 10-digit number that was available. That's the green number. Those calls still get answered, but they're routed now, directed to 988. And then on 988, we have 2 primary prompts that exist. One of those prompts on the telephone tree will be if you're looking for support for veterans, press 1 for the Veterans Crisis Line. Those calls are answered by veterans or caregivers. If you're looking for Spanish resources, press 2. You'll be connected to a bilingual specialist. Those are powerful. There had been a third option for LGBTQ plus youth, and both the 988 and the crisis text line have filled the gap when that service was no longer made available. So I want people to know, yes, there's awareness that there are other high-risk groups and that the gap has been filled. Support is available. Crisis text line is a second option, and many people who are younger prefer that texting option. Here, you text help or connect to 741-741. And that will take you to an automated texting service. The first response you'll get, thank you for contacting Crisis Text Line. We're looking for a counselor. And then a person will come online and that person will say, hi, my name is Cal. How can I help you? So I just wanted you to be aware, those are 2 primary numbers, 24/7, 365. They're free, anonymous, and confidential. So I just wanted people to recognize that that is the front line of support. Some of your apprenticeship programs may have an employee assistance program, also known as an EAP. Some unions have built internal EAPs, frequently called MAPs or Member Assistance Program. If you don't, you might have an option through a health plan, but different apprenticeships have different rules in terms of the eligibility when health care coverage becomes available. So at minimum, each program could post 988 and crisis text line information. You could request stickers from different organizations that could go on hard hats or cell phone covers or on textbook, whatever materials you want people to have access to. Vicki and I are going to be putting a resource list together at the end of the third webinar in this series, and maybe we'll get to that by the end of summer. But I just want people to know, if you're looking for help and ideas, feel free to reach out to me. I can help share additional information. I want to encourage you to make a demo call, like a practice call, to 988. If you're concerned about the well-being of someone in your family, of a friend, or even an apprentice, what better way to learn by making a demonstration or practice call? And just tell them, I attended a training class. I was told that we could make a practice call. I want to learn how the routing works so I can explain it to my friend or to my student. And those are powerful conversations, because now you're equipped to know what is going to happen when you make that call. It's going to give you confidence and competence to be able to have that conversation. And they can help you plan your conversation with a person you're concerned about. So I also wanted you to be aware, Minnesota is one of the leaders in providing mobile crisis support. By calling 988, you have the ability to get help for people. Some states don't have the mobile crisis support. You have to also call 911 and they'll dispatch law enforcement to offer support. Many, if not most, of the Minnesota counties have mobile crisis response. The two links I've given you will be numbers for adults in crisis by county, and the other will be for children and youth. I wanted you to be aware that this mobile crisis response is powerful. Several years ago, when 988 was launched, I was able to help 4 Minnesota employers by contacting the county that the employer was in or that the employee lived in. And I said, let me call to verify that the mobile crisis response team is available. And in about an hour from the initial call, we had a dispatched mobile crisis team offering support and guidance to a person who was in distress. So I wanted you to know about this mobile crisis response. I also wanted you to see the warning signs of suicide, but don't wait for the crisis. When you see a change in behavior, intervene, have one of these safety conversations. So again, today I'm providing you an overview of information. I'll be sharing with Vicki some additional resources in Minnesota. I have some additional embedded in this program, but the warning signs are important. These are signals that a person is experiencing emotional pain or distress. And if someone loses hope, then it's possible that they may take an action like self-harm or suicide. So I also wanted you to think about, this is a 5-step safety plan. It's called Learn Saves Lives. One of the resources that I'll be sending Vicki to share with individuals, if you want to learn more in a 1-hour program, it's self-guided online. You can learn more about Learn Saves Lives. The employer I worked for in Washington participated with the University of Washington School of Social Work as they were launching this Learn Saves Lives. We adopted it and taught leaders in our company and ultimately our employees. But the first step is look for warning signs. The second is empathize and listen. And you noticed you had active listening, you had empathy, care, compassion. The third step, the A step, is the most important. It's asking someone if they are considering suicide. So if we were a live audience, I would have you practice that as a group. and then with a partner, and then have the other partner practice that as well. But you would ask someone if you're thinking of suicide. You'll find that that's a very important step. It lets the other person know that you understand this could be the difference between life or death. If someone says yes, you're going to stay with that person. You're going to encourage them to make a call to 988 or to connect to that crisis text line, to an EAP, to call a family member, or to call a doctor or a therapist. Sometimes you'll end up taking that person to one of those facilities. And notice the N step is next steps. It's the referral. So I kind of bake that into that remove the dangers by staying with the person. You're building a buffer. And the last thing on this I wanted to say, it's really important. Research showed about 9.5 minutes from the time a suicidal ideation entered someone's brain to them taking an action. So if we build a 10-minute safety conversation, we can build a buffer of safety, time, and space, and that can help save a life. That simple act of demonstrating care, concern, empathy can be enough for that person to seek help. And it's a powerful process when you get to experience it. So here's where I want to finish. I got a few more polling questions. After today's session, who are you going to have a safety conversation with? Don't write the person's first, last, or nickname, but list the role or the relationship. Maybe it's a student, maybe it's a family member, maybe it's a friend. I just would like to see what I experience is people, if they write this down, they tell me years later, I had that conversation. Recently, I returned to a company, and 4 years ago, an individual said he was going to talk to his fiance. She was struggling, and he told me she's now my wife, and now she's the mother of my child. Thanks for teaching me how to have a safety conversation. So thank you, students during first aid training. Perfect opportunity. My sister, dad, daughter. I just wanted you to know how important this is. Don't forget about grandparents. Suicide rates among older individuals have increased. And this is a really important step for you to think about. As a father of 5, thanks for listing moms and dads. Roles change, people start to feel different. They start to feel more isolated. Think about those seasons of life. Thanks for listing colleague. So I also wanted to give you an opportunity to list what's your biggest takeaway from today's session. I know it's bold to take an hour and to think that we can equip you and teach you, but what's going to follow then will be some additional resources. And then Vicki, I'll hand it over to you for Q&A in just a few minutes. But what's your biggest takeaway from today's session? The action you're going to take or recommend at your apprenticeship. I see 4 or 5 people typing, seize the awkward, ask the awkward questions. Bigger push to normalize mental health, learned easy to use phrases. They're non-clinical, they're conversational. It makes it feel like we're having friendly safety conversations. It's no different than a daily safety huddle on a job site. It's no different than a morning duck-in meeting that we have in workplaces. It's okay not to be okay, and let people know that. So yes, absolutely powerful. Everything is hard to do without practice. Talking about mental health is no different. That's why I wanted this to be a conversational session. So I'm going to move on quickly. I'm not going to cover these because, again, I want to save time, but there are 7 key steps for apprenticeship leaders. I've built these just for you. It'll start with top-down leadership support and then connecting with local resources. And that's where I want to go. Every place in between will be unique to your apprenticeship program. But to save time, and since I'm sending you, or Vicki's going to send you the PDF and the resources, I'll move forward. But you'll notice that 3rd step was it's okay to not be okay. Help is available. And what I wanted you to just know, there are additional resources. I've included Safe Project has a locator. It includes treatment, family support, and recovery housing. for aftercare, after treatment. That is a free service. If anyone is here from a healthcare related program, the Center for Workplace Mental Health built this incredible tool for frontline healthcare workers. I knew it was one that I could include. There's a nonprofit based in Bloomington. It's called SAVE, Suicide Awareness Voices of Education. I had the opportunity to meet with them last month. Eric Mishi, Jen Owens, and Gretchen Saffert is her name. They're doing some incredible programming. They said that I could offer you free gun cable locks. So on the slides, you'll have this link to a form, and you'll see that self-locking lock will give you an opportunity to provide those in the classroom, to have conversations. We call that restricting access to lethal means. And SAVE, as another national nonprofit, has done some incredible work, and they wanted me to make those available to you. The Minnesota chapter of the American Foundation for Suicide Prevention is an excellent organization. You've known NAMI. Some of you heard Vicki say at the very beginning, a series was done with the National Alliance on Mental Illness. They're an incredible organization. They help so many people, and you can feel confident referring people to that organization. And then if you're looking for a good resource that you can direct people to, this is from an organization called Rural Minds. And this is an alphabetized list, A to Z, of mental health resources. It's a great way to learn when people are saying they're looking for help. You can feel confident guiding them. That list has been vetted. So Vicki, what I want to do is just ask these two final questions. After today's session, how comfortable do you feel talking to apprentices about mental health, substance use, and suicide? So we'll give you a moment to respond. And then the next question is going to be, do you feel more equipped with resources? Obviously, you have to get comfortable with those resources. So we did see an increase from around that 6.6 to 8.7. I wanted to show you so you could feel comfortable making these safety conversations. It's what worked for me as a safety and risk management professional. So thank you for those who have voted. And then after today's session, how well equipped with resources are you to talk about mental health in the classroom? Obviously, you'll need to see the resources. You'll have to dig into them. But that was a really important goal. I felt if I could equip you as instructors and program coordinators, we were more likely to be able to implement strategies that would help students get help. So we went from about a 5.5 to an 8.3. I welcome your contact. Feel free to reach out to me. Vicki, I know we've got about 5 minutes left, maybe 7, depending on which clock I'm watching. I'll turn it over to you for Q&A, but thank you for this opportunity. Thanks to the learners today for completing the polling. Made that interactive and fun.
Yeah, thanks so much again, Cal, for your expertise and time today. I do want to actually shout out 988. Earlier this week, I had someone reach out to me because they knew someone in crisis. And I was like, hey, don't forget that 988 can prepare you on how to engage in a conversation with this individual. And so they were able to not only talk to 988 prior to going to their friend, but then also have resources available on facilities that their friend could potentially get treatment at a quicker rate than what we were able to find in our quick struggle as like a community on our individual. So again, it's always important not to you don't have to know all the resources and answers, but at least point someone in the right direction. But yeah, if anyone has questions, feel free to come off mute.
No one has to feel bashful. I told Vicki the first time on this topic, you don't always get a lot of questions, but feel free to ask if you want to either use chat or unmute yourself.
Yeah, Janet, it looks like you came off mute.
Yeah. If if you could pick one first step in starting to incorporate this into a culture, what would it be?
Believe it or not, what Vicky just said is one of the most important first steps. So I think she said your name is Janet. So Janet, I
Yes.
would encourage, let's get posters for 988 and crisis text line. Let people know it's okay to not be okay. I had the opportunity to attend a training session. They talked about 988. We can send you additional information so you can feel confident. Nationally, about 64% of people know about 988. I bet in Minnesota, my experience has been over 85%. So I think it's going to be something they're comfortable with, and then normalize that. That would be my first step. The second would be, do I have any staff members with lived experience who might be willing to make themselves vulnerable and to just lead a conversation about mental health and suicide prevention or substance use if that person happens to be in recovery? Those are powerful testimonials that let people know that help is available and that people do get well. So those would be two first steps. If you don't have someone with lived experience, partner with a local nonprofit and ask them to partner and come into your classroom and lead a conversation as well. It's one of the most enjoyable experiences as an outside nonprofit member to get those experiences I mentioned at the very beginning. The students just embraced it, and they were so thankful to their apprenticeship for connecting them to a person like me who has lived experience, who could let them know where they could turn. So I hope I answered your question, Janet.
Yeah, thank you. That's helpful.
What industry are you in, if you don't mind me asking?
I'm in the early childhood education industry.
Excellent.
We're new to apprenticeship, so we appreciate the added resources.
You're welcome, and thank you so much for sharing. Vicky,
One
any
thing
other?
that, yeah, oh, looks like John. John joined us. Hey, John, good to see you.
Hey Vicky, hey Cal, I am so sorry I was late today. I got pinned down on some other things, but I would be a fool not to say hello to you both and thank you both for putting this information forward to those of us who are operating, not just in the apprenticeship space, but just as neighbors, friends, family members, the importance of this subject. So I just want to say, hey, it's good to see you, my friend.
John, I saw you come in
Likewise.
a little bit later, and I knew you must have been with learners today, but I gave a shout out to your great apprenticeship program and what you've done with team wellness at work. And you've done the physical health screening, it's led to mental health screening, and that's led to wellness checks and people reporting back that their lives were saved. And you are one of my heroes. And
Oh man.
anyone
Same.
that wants to learn about your program, you're going to be an open book. And
Oh,
so I
man,
gave
we are
that shout out at the
happy.
very
We are
beginning.
so happy to share. And, some of the things that we have done, it's been an amazing group effort of like-minded five people thinking about what is possible. And, the health assessments we've done with our apprentices had led to an EAP utilization rate this last quarter of almost 90%.
Oh my goodness
Um,
gracious.
the resources that are taking place, but our unique truancy approach where a student will no call, no show. And back when I was a young person in the trade, you got the old what for phone call and three strikes you're out. See you later. We don't need you. And today, when somebody no calls, no shows, our clinical staff will call and say, "Hey, John, we noticed you weren't at school today. Are you okay?" And in 2025 alone, those outreach phone calls to no call, no show students stopped 5 active suicide plans. It does work. Folks are receptive to the resources if you put them in front of them. That was our greatest fear, that we would put all these great resources and nobody would use them. And what I've learned today is that I cannot get enough resources put together fast enough.
Yes. What a testimonial. And Vicky, it's why we knew we had to offer a multi-part series to let the apprentice leaders know this does work and lives can be saved, and it can make you an employer of choice, and it can help with your successful retention at the end of the learning process. And John, I know you're going to see those numbers in your program. I know you already have.
It's a great retention tool. It's changed the way we speak at the school. Folks speak about mental health illness, substance use disorders, no differently than diabetes, high blood pressure, or high cholesterol. These are medical diagnoses that require medical care. And we try to keep it that simple. This is healthcare. And our students and our incumbent workers deserve the healthcare that they need to be the best version of themselves. And the stigma is really starting to wane, and the normalization we have seen in the conversations in the hallways, in the classrooms, and even what I hear from some of our clinical staff. So if you don't think it's possible, I would beg to differ that it absolutely is.
Well, again, what a testimonial. John, I'm so glad I got a chance to see you, and that love and respect is right back at you. And Vicki, thank you for facilitating this today. We're looking forward to part 2 on stigma to provide workplace supported recovery, mental health, substance use, and other challenges that people face in the workplace, and part of the normalization process. So thank you very much, Minnesota Department of Labor and Industry.
Yeah, thank you everyone for joining us today. We are at time, so I won't hold you all much longer, but feel free to reach out to myself with any questions, or to Cal. We're here to help, and we'll send an email with the slide deck and resources.
Sounds great, everyone. Take care. See you July 29th. Thanks, Vicki. I'll hold just in case anyone wants to stay around. That was a pleasant surprise.
Yeah, it was so nice to see him. Oh, sorry, ending this.